Hello and welcome. Today we're diving into a condition that, while not widely discussed, affects many individuals: pilonidal disease. We'll explore what it is, why it happens, and how it's managed. Get ready to learn about pilonidal disease. The exact cause of pilonidal disease is still debated, but the leading theory involves ingrown hairs. It's believed that loose hairs, often shed from the back or buttocks, penetrate the skin in the sacrococcygeal region, the area at the top of the cleft between the buttocks. Friction, pressure, and prolonged sitting can contribute to this process, forcing the hairs into the skin. Other contributing factors may include deep natal clefts, excessive sweating, and genetics, potentially predisposing some individuals to this condition. Once hair penetrates the skin, the body recognizes it as a foreign substance. This triggers an inflammatory response, leading to the formation of a cyst or sinus, a small cavity or channel beneath the skin. This cyst can become infected with bacteria, resulting in an abscess, which is a collection of pus. The abscess causes pain, swelling, and redness. If left untreated, the abscess can rupture and drain, forming chronic draining sinuses. The cycle of inflammation, infection, and drainage continues, perpetuating the disease. Pilonidal disease most commonly affects young adults, typically between the ages of 15 and 35. Men are more likely to develop the condition than women. People with sedentary lifestyles, such as those who sit for extended periods, are also at higher risk. Obesity and a family history of pilonidal disease are additional risk factors. While not a widespread condition, it's estimated that it affects a significant percentage of the population, causing considerable discomfort and impacting quality of life for those affected. The signs and symptoms of pilonidal disease can vary depending on the severity of the condition. Initially, there may be no noticeable symptoms. However, as the condition progresses, individuals may experience pain and tenderness in the sacrococcygeal area. A visible pit or sinus opening may be present on the skin's surface. If the cyst becomes infected, symptoms can include swelling, redness, warmth, and drainage of pus or blood. Fever may also occur in severe cases. Chronic pilonidal disease can involve recurrent cycles of pain, drainage, and periods of remission. Diagnosis of pilonidal disease is typically made based on a physical examination. A doctor will visually inspect the sacrococcygeal region for signs of inflammation, swelling, and sinus openings. They will also palpate the area to assess for tenderness and the presence of a mass. In most cases, no further diagnostic tests are necessary. However, in complex or atypical cases, imaging studies such as ultrasound or MRI may be ordered to rule out other conditions or to assess the extent of the disease. While pilonidal disease isn't usually classified into distinct types, it can be described based on its severity and chronicity. Acute pilonidal disease refers to a sudden onset of symptoms, usually involving a painful abscess. Chronic pilonidal disease is characterized by recurrent or persistent symptoms, such as draining sinuses, often spanning over extended periods. It can also be classified on whether it's infected or non-infected. Treatment for pilonidal disease depends on the severity of the symptoms and the presence of infection. For an acute abscess, incision and drainage is usually performed to relieve pain and remove the pus. This can be done in a doctor's office or emergency room. For chronic pilonidal disease, several surgical options are available, including wide excision, marsupialization, and flap reconstruction. Wide excision involves removing the entire affected area, while marsupialization involves opening the cyst and suturing the edges to the skin to allow it to heal from the inside out. Flap reconstruction involves using tissue from other parts of the body to fill the defect created by the excision. Non-surgical treatments, such as laser hair removal and endoscopic pilonidal sinus treatment (PCT), are also emerging as less invasive options. Antibiotics are used to treat infection, but are not a long-term solution for chronic disease. Preventing pilonidal disease involves maintaining good hygiene in the sacrococcygeal area. This includes regular washing with soap and water, especially after activities that cause sweating. Avoid prolonged sitting, and if you must sit for extended periods, take frequent breaks to stand and stretch. Hair removal techniques such as shaving, waxing, or laser hair removal may help reduce the risk of ingrown hairs. Maintaining a healthy weight and avoiding tight clothing can also contribute to prevention. The prognosis for pilonidal disease is generally good with appropriate treatment. However, recurrence is possible, especially after simple incision and drainage. Surgical interventions, such as wide excision and flap reconstruction, have higher success rates but are also associated with a longer recovery period. Recent research is focusing on less invasive treatments, such as endoscopic techniques and the use of biological adhesives, to improve outcomes and reduce recovery time. Ongoing studies are also exploring the genetic factors that may contribute to pilonidal disease, which could lead to more targeted prevention strategies in the future.